Hello, hello. Oh my God, what happened? I have a spot. Are you kidding me? Oh my God. Hi, you guys. Jill from the IC Network. Time for a support group meeting. I'll be right back. Are you kidding me? How the hell did that happen? Well, that just sucks, eggs. Hello, 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 hello. Now, hold on a sec. I think I set up Facebook on the wrong stream. I did. My Facebook, I'm turning you off. Sorry, I'll do it on the right stream. It's been one of those mornings, my friends. It has been one of those mornings. All right, let's try this again. We are expecting, we're on a red flag alert. So people are just a little bit on the hyper side right now for fires, just saying. All right, hold on a sec. I set up my Facebook stream on not on my business page. It's a mistake. All right, fix that. There we go. We got that set up. Live IC and pelvic pain support group meeting. How are you feeling today? Struggling? Need some wine. All right. All right. Hello, YouTube. All right. There we go with Facebook. So I had my whole outfit set up, right, that I was wearing today. And then literally the last thing I did was try to get something together for my mom's breakfast. And I ended up getting something all over my top. So I had to go quick and change it real quick. All right, there we go. Facebook is all set up. Let me see if I can just move this over here and then we are good to go. There we go. There we go. All righty. Well, hello, you guys. How are you today? How is life? How is life? How is your IC? How are you feeling? Are you enjoying summer? What's happening today? There you go. Hi, Anne. How do you use the pelvic wand? You can't. Anne, I just restarted Facebook. We're good. Hi, Donna. Nice to see you. Well, okay, we can talk about that. We'll definitely talk about how to use a pelvic wand. Let me grab one real quick. Let me get my things I need, which are number one, gotta have my model. The model works. Gotta get my sign working. Come on, there you go. Come on. And let me grab a wand real quick. All righty then. Hello, Facebook. Nice to see you guys. Hope you're doing well today. All right. So my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I am the National IC Support Group Leader, longest-serving IC Support Group Leader in the United States. Close to being in the world. Hello, Corrine from Belgium. Nice to see you on Facebook. Hope the sound's okay with everybody. The video's okay with everybody. Crossing our fingers, my friends, crossing our fingers. My purpose in doing these meetings is to make you so strong, knowledgeable, informed that no one can mess with you again, because that sure happens way too much. And you know, I think there are two really other important purposes for doing these meetings. Number one is I really want you to see that you're not alone. You know, if you've ever talked to me on the phone, what I always say at the end of our conversation, I always say the single most important thing I want you to remember from this conversation is that you've done nothing wrong. This is not your fault. No shame, no blame. You're hurt. You're hurt. For most of us, there's some sort of injury involved. For some of us, there's a bit of a disease process happening, but not for everybody. For a lot of us, it's really trauma. And so I really want you to get good information so that you can work more effectively with your doctors. I want to be able to teach you about different things related to the pelvis that you might not be aware of. And I think most importantly, I want you to give you a place where a soft place to land. You know, it's really, really hard when you've got critics in your family or you've got a doctor that's aggressive. And we're all under a lot of stress right now. The last couple of years have been exhausting for all of us. And I think that your wellness is incredibly important. I want you to be able to find joy in every day. You know, I was talking yesterday with a very, very good friend of mine who was just, as I was listening to her, I was just like going, where's the joy? Where's the joy? We need to bring some joy back in our lives. We need to be doing some things that make us laugh, that make us smile, that keep us functioning. You know, listen, it's hard when you're in pain. And it's hard when you have something that other people can't see. This would be a hell of a lot easier if it was your shoulder, right? Everybody gets a shoulder. If you dislocate your shoulder, they can see it's dislocated. If you can see, you know, you can wear a splint. We know healing happens. But one of the challenges of having pelvic pain is a lot of it's hidden. Y'all can't see it. It's inside the body, right? And it's hidden inside the pelvic cavity right here. There's a lot of stuff happening in your pelvis. Remember, your pelvis is the center. It's the core of the human body. It carries the weight of your torso, because it has the biggest bones in the human body. The way your body's designed is the bigger the bone, the more weight it's meant to carry, right? And so the biggest bones you've got are your hips. So obviously this is going to carry your torso. And then also it's going to deflect any of the forces and stresses that come up from your legs, because they're going to come right up your legs, right up your leg bones, right up your leg muscles, right into your pelvic floor. So, you know, I want to start by telling you a little bit about a patient that I was working with on Friday. It was fascinating. It was just really, really fascinating here so that you can kind of try to understand cause and effect. So here we have a 71-year-old woman whose symptoms for the last 6 to 9 months have been really, really bad, like really, really bad. And as she wanted to know what she could do to try to reduce her symptoms. And she'd been working with her doctors. Her doctors really didn't give her, you know, kind of a clue. One said pelvic floor, one said bladder installations, one said estrogen atrophy, et cetera, et cetera. And to a certain respect, those were all relevant. I'm sorry, she was 71 years old and not using estrogen. Clearly her skin was dry. There's no doubt about that. So I had to go through and explain the whole genitourinary syndrome of menopause and explain why it's important to use your estrogen, because in her case, they gave her estrogen, but they didn't explain why it was important to bladder health. So we go, you know, I'm going kind of down this pathway with her of, okay, maybe you're having just an estrogen atrophy related issue, that you're at 71, your estrogen levels are done. thus your bladder's ability to protect itself is now compromised. And so we absolutely have to look at that. But then, she kind of gave me a few clues. It's like, yeah, but gosh, when I sit down, it really hurts. Or what else did she say? Listen, there was a little bit of pins and needles sensation in her body, and a little bit of numbness happening in her thigh, on her perineum. And so, now we've opened up another door, and the other door is, okay, well, pins and needles are not a sign of IC. And it's not a sign that doesn't happen from your bladder wall. Pins and needles happen because we have a nerve that's being compromised. So generally, a nerve is being compromised, perhaps by a muscle, right? And so she's like, okay, I didn't really understand that. Okay. And I said, well, what's going on with your pelvic floor? And she goes, well, I've gone physical therapy. I can't say I'm any better. It doesn't seem to be making that much of a difference for me. And I said, well, what did the physical therapist say about your muscles? And she said, well, she said that my muscles were some of the tightest she'd ever seen. And I was like, oh, okay. And she said, but we can't get them out of tension. They're always tight. So I just feel like I want to give up. I mean, they're always tight. What do we do? And I said, well, has she helped you try to figure out what could be causing that muscle tension? Usually it's a bony structure, right? So could be a bad hip, a bad SI joint. And she goes, this is where it gets hysterical, right? So she goes, well, it all started after I had surgery. So she had major back surgery, and she had lower back issues. And it's like, okay, well, that makes sense because it was down off of her sacrum and in her lower back. And then she said that, well, she also had to have a hip replacement. And I'm like, okay, well, then we certainly know you've got some bony structure stresses on your muscles because you've had a hip replacement. And then she said, yeah. And I'm talking to her about the hip and the SI. And then I get to the knee, and she goes, what about your knees? Do you have any issues with your knees? And she's like, oh, yeah, I had a knee replacement on the opposite side. And I'm just like, okay, so now we know we have a knee issue. Here, hold on. Hold on. All right. So, okay. So here we have a woman. She's had major low back issues. She's had a bad hip, so bad that she had to have her hip replacement. Then the opposite side, she had a bad knee. And that's where things get extremely complex. Because yes, at her age, certainly we're going to be looking at estrogen atrophy of her bladder wall. But the reality is that every time that they've looked at her bladder has been completely healthy, just like mine. So there was not a bladder wall dysfunction with her or Hunter's lesions or anything like that. It's just, it's just the fact that her bladder is the secondary victim of a much more serious dysfunction happening with her. And that means that she really is having substantial muscle and bony structure problems. And, kind of in this case, you guys, as I said to her, you can do bladder therapies up the wazoo. I didn't say that to her, but bladder therapies are not going to fix a muscle problem. And ultimately, in the end, it's about consistency. It's about her working with her physical therapist to try to get her muscles as relaxed as possible knowing that because she's got one hip that's funky and one knee that's funky, she's probably going to keep going into tension. And so it's going to be a daily thing for her. She's going to have to work on relaxation. She's going to have to work on muscle health. And she's probably going to have to do some internal work. And her physical therapist actually told her she should be doing some internal work, but she didn't know how to do it. And so really, our first question here today from Anne is, how do we use a wand? So how do we use a glass wand? So here's the thing you got to understand. Remember, the pelvis, I see as a pelvic pain disorder. You should not be assuming that's an incurable bladder disease, because for many of you, it's a pelvic pain syndrome, a pelvic pain disorder. Why do I say that? Because in the majority of patients, there's structures outside of the bladder that are often contributing to, if not causing, your pain. The second thing you've got to remember is that things do not operate in isolation. The bladder has a lot of influences on it. Just like for men, your reproductive system; for women, your reproductive system, and you've got your bowel, you've got muscles, nerves, blood vessels, et cetera, and they all live inside this pretty small cavity. And so it gets really, really crowded in there. Here's the other thing, is that they share nerves. The nerves for all of these structures merged, and they're together up here at the spinal cord. And so if you've got, for example, an irritated bowel, odds are your bladder is probably going to feel some irritation, because we call that neural crosstalk. And of course, the other issue that we've got with the pelvic floor is that this is what helps you walk. It helps you open your legs, close your legs. It's critical to having babies, all that sort of stuff. So we have what we call skeletal muscle that assists us in moving our bodies in our pelvic cavity, right? But here's the thing you got to remember. Number one, you can't reach these from the outside. It's pretty hard to reach them from the outside. They are, in fact, usually on the inside of your bones, right? And they're also flat along the bones. If you can see this, you can see that they don't pop up. The only time that they pop up into the pelvic cavity is if they're under stress and if they're tight. So in general, we're always going to be working on muscles to try to get them to lay flat. Now, you can see, so obviously this isn't exactly your anatomy. We have to put on, for women and men, we have to put on your levator anis, right? Okay. And you can see that the best way to access these muscles is going to be vaginally or rectally. So let's look at, we're going to take those off for a moment. Let's look and see what a finger can reach. So when you're at a physical therapist, and they're doing their examination, they're going to use a finger, and they're just going to get in here, and they're going to touch muscles. You've got 3 layers of muscles. You've got shallow muscles, you've got mid-level muscles, and then you've got really, really deep muscles. And you can see here, look, I got to get my finger all the way in there to actually reach some of these muscles. See that? That's challenging. So when you go to pelvic floor physical therapy for your pelvic floor examination, they're gonna look at your body. They're gonna look at your legs. They're gonna look at your lower back. They're gonna look at your abdomen. They're gonna look for tension patterns externally. They're also gonna have you walk down a hallway and back, because they want to see how you're walking. We want to see if there's anything abnormal about the way you're walking. Are you limping? They should measure the length of your legs. Do you have one leg longer than the other? Because if you do, then you can see right off the bat that you're going to be tilted. And over time, that's going to play a role in your pelvic health, especially if you're like a runner. You know, if you're in your teens or 20s, your body's really resilient. You might be able to run with a little tilt, but you're eventually going to have you're going to start to have some wear and tear issues. And if that's the case, eventually we're going to start seeing some dysfunction in the pelvic floor from having one leg longer than the other. So when you go to PT, they're also going to do an internal examination, and they're just going to touch muscles. And it's really weird, guys. It's really weird that they can actually touch your hip bone. I mean, I always thought that was fascinating. I always thought it was a little bit farther apart, but they can actually rub their finger along the inside of your hip bone, and it doesn't hurt at all. Bones don't hurt to that degree. Muscles, though, have the potential of hurting if there's a trigger point in there. So what they're going to do is they're going to gently touch muscles, right? All over the place. And if they can touch a muscle and trigger your pain, what do we call that, my friends? We call that the hallelujah moment. It's like, oh my God, that's it. What are you touching? It's very, very important that you immediately ask them, what are they doing? What are they doing? What are they touching? Because when we know what that is, we can then do physical therapy. You got to understand too that you've got a bunch of different muscles that move in different locations. They do different things. And so each muscle group will have its own rehabilitation program. It's not like you just do Kegels. In fact, anybody who tells you to do Kegels is wrong. You don't do Kegels for hypertonic tight pelvic floor muscles. That will only make it worse, right? That will only make it worse. So the question then is, how do we use a wand? So getting back to the patient I was working with. Now listen, she's going to probably have tight muscles the rest of her life because she had a hip replacement. She's got a bad knee, and there's no doubt that her pelvis has been traumatized and her pelvic floor has been traumatized. But is her pelvic floor normal? No, probably not. Probably not. There's probably some minute stresses or major stresses from whatever surgeries that she's had. And so it's going to be very important that she, on a daily basis, try to work on her muscles and to keep them relaxed. And the way you do that is with a wand. A wand will get you farther in than your finger. And it's super easy. Guys, I do it at least twice a week myself. As soon as I feel my muscles starting to tense up, I know that they're lifting off of that bone. I want to get them back down and flat on that bone, and the wand does it. So with the wand, what you're going to do is you're going to insert it vaginally or rectally, depending upon which one, if you're a man or a woman or what your doctor wants you to do. And then you can see how easy it is to move it along the muscle. Now, the other thing is, I remember when my physical therapist was first teaching me how to do this, she kept saying it's a J shape. I didn't get it. I did not understand the J shape. But it's a total J shape. It's a J shape this way, right? That's one half of the J on the left side. And then here's the other J on the right side. So they're absolutely right. It is a bit of a J shape. And so you're going to be using your wand. And normally what they will have you do is follow the length of the muscle, right? But sometimes they want you to actually do it this way. Or they might, if you have a trigger point, you would actually push on the trigger point for 5 or 10 seconds and then release. Push on the trigger point and then release and try to breathe through it. And so these wands, and there are straight ones and there are curved ones. I personally believe that the curved ones are by far better than the straight ones. So, it sucks. It sucks that we have an internal muscle trauma or muscle problem. It sucks. It would be so much easier if it was our arm. It'd be so much easier if it were our leg. But you know what? That wasn't in our hands. At some point in time, we were hurt, and we have to work with those muscles. And the best way to work with those muscles is internally. So, one of the books that's has really good kind of insight into how to use a wand is this book. Here, hold on a sec. It's this book and this book. So if you're still struggling to use your wand, Isa Herrera's book, Ending Female Pelvic Pain, has a whole section on how to use wands. And for men, she has Ending Male Pelvic Pain. And I get it, man. I get it. I understand that it sucks. It sucks to have to do internal work, but it's also remarkably freeing to know that you can do something about it. It's stunning to me how much better I feel down there than when I keep my muscles in good shape. It's just absolutely stunning. All right. So Normally when I do these meetings, I do a 30-minute little lecture, and then I take your questions for 2 hours, and we would go into Zoom, something like that. I will tell you that our magazine, our summer magazine is now at the typesetter. I did want to clarify something. So, so I think this is just one little piece of our puzzle here. At our last meeting, we talked about a new name for IC. And this is from the European Association of Urology's guidelines for chronic pelvic pain. And they just, understand that the powers that be they want consistency. They want doctors to be evaluating patients in similar ways, and they want doctors to be treating patients in similar ways. And they want doctors to be calling this the same thing. It doesn't help if one doctor says this is, honeymoon cystitis, and another doctor says this is chemocystitis, and another doctor says it's interstitial cystitis, and another doctor says it's hypersensitive bladder syndrome. It's a very, very challenging when you've got doctors that are calling a different thing. So there's been a concerted effort in the last 20 years to be consistent. So what the European Association of Urology is now using to call this is primary bladder pain syndrome. Primary bladder pain syndrome. And I'm not quite understanding part of the rationale for this. I really haven't had an opportunity to get into this a little bit more. There's much debate on the subdivisions of pain syndromes within the hierarchical taxonomy. Yeah, right, which you and I don't really want to read. The pain, well, you know what? I don't even need to get into this. Let's just say that all they're doing is dividing things up in more consistent ways. So they're going to have, so these are their pelvic pain syndromes. They have pelvic pain syndrome, primary bladder pain syndrome, scrotal pain syndrome, urethral pain syndrome, gynecological aspects of pelvic pain, anorectal pain syndrome, and there's prostate pain syndrome, primary, yeah, it's kind of, okay, so does this mean for anything for us? No, but don't be confused if somebody uses the name. Okay, again, it's just all about consistency. All righty, well, let's just dive into your questions. I don't really have much more to say. Trying to get IC 101, our book, up on Amazon. Got all the articles written for our next magazine, waiting for one more article from a dietitian. One of the things that I'm really trying to explore is nutritional deficiencies in IC patients. I think that some of you are afraid, you're afraid to eat so much that sometimes we start to see malnourishment. And so I've got a new dietitian who's specializing in IC working with us now, and she's currently working on an article on that for us because we want to make sure you're as healthy as possible. You should not be afraid to eat at all. There's no fear associated with eating it with IC. You just have to eat. Number one, we have to understand your subtype. I mean, obviously, if you've got IC subtype 1 Hunner's lesions, which are open wounds on your bladder is going to be hella sensitive to acids and foods. So the people who have to be the most careful with their diet are people with Hunner's lesions. The second group that are going to be vulnerable to diet are going to be estrogen atrophy patients or chemotherapy, chemocystitis patients. And or if there's some other issue with the bladder wall, then yes, you are going to be challenged with diet. And, it's interesting when I'm working with patients, we tend to go through their list of all the things that they're eating and drinking and all the supplements they're taking. And I'm stunned by the number of patients, like, again, the lady I was working with on Friday, she was doing a green tea extract supplement. And it's like, oh my God, stop immediately. Green tea is terribly acidic and extremely caffeinated. So that was also one reason why her bladder was probably screaming a bit along with her muscles. But if you got pelvic floor driven, if you got pudendal neuralgia, the odds of you needing to modify your diet are pretty slim. Now, if you're IC subtype 5, central sensitization, chronic overlapping pain conditions, which is what I am, then you're going to certainly have to avoid caffeine, because the nerves in your body and the nerves in your bladder and the nerves in your stomach and the nerves on your skin are more sensitive. And so we certainly don't want to be doing things that will amp up nerves and irritate nerves more. So eliminating that caffeine, if you've got IC, IBS, vulvodynia, and all those other related conditions, is important, because we now know that that's a central nervous system sensitization thing going on. What else do I have? What else are we working on? Haven't had an update on the Elmeron lawsuits recently. I've been trying to get information on that. I'd really like to know where that is right now. Oh, duh. Oh my God. Like, I totally forgot to tell you the most important thing. Let me show you. So we have been working now for the last 6 months on a new app for you. It's called the Bladder Tracker. And it's really cool. And so the purpose of this, now we're still doing beta testing on this. It hasn't been released yet. But, I think that my motivation in doing this is I want you to be able to track your symptoms. And I want you to be able to share those symptoms with your doctor and try to get them into your medical records. Because it's really important that we have objective data that proves that you've got frequency urgency, so that if you ever need to go apply for Social Security, you will have information in your medical records to prove that, yeah, look at this, from, that this person is up 3 to 4 to 5 times a night, et cetera, et cetera. And so this new app is very close to being released. Bladder Tracker will do that. And it's a collaboration between the IC Network and Natural Approach Nutrition. So as an example, let me show you this. This is so cool. So the first thing you get to track is how you're feeling that day, your overall wellness, right? Then you get to enter how often you use the restroom. And you also get to measure your pain. And so in this case, so if I were to do today, I would say, so you can push it and it will tell you. So obviously red is intense pain. Green is no pain. So I've had no pain. So my entry is going to be no pain before urination, no pain after urination. And my stream health, of course, your stream health will tell us what's going on with your pelvic floor, is, I'm just going to say, moderate. I'm not going to say it's strong because my muscles are tight right now. And then you can also time it, and that really will just really kind of help us, see if you're voiding easily or not, or help you see. And then did it wake you up from sleep? So did I get woken up from sleep by my bladder last night? The answer is no. All right. So then look at this. You can also track your stress level, because we certainly want to look at your symptoms with respect to your stress level, because listen, when you're under stress, you're going to tighten your muscles, and that's going to amp everything up, right? It's going to intensify your pain. So it's helpful to track your stress. You can track your pain. And so where is your pain? Your bladder, your pelvic floor, your lower back, your rectum, your urethra, perineum, vulva, tip of the penis, and the type of pain you're having: burning, pins and needles, aching, shocking, pressure. And then you get to rate your pain level, right? With these color coding. Isn't that cool? Look how easy that is. You get to track what you're taking. So again, you can see cause and effect. What are you taking, and is it helping your symptoms? And so this one has, the only thing I take Piora and Bladder Smart. So that's what I've got in there. So you can add whatever supplement you're taking, or you can add a new supplement if you want. You can track your diet, what you're eating, if you want to do that. You can track your water intake, your exercise level, That's kind of important because my exercise has been terrible the last couple of days. So my exercise is minimal, less than 1 hour. That's very true for me the last 3 days. Your sleep quality, how long are you sleeping? I slept 6 to 9 hours last night. This is hysterical. You can track intimacy. You don't have to, you can. And it's just, were you sexually active? And I love that it's under a rabbit. That's hysterical. And then you can make extra notes, right? You can make notes. And so what it does, then it gives you, let's see, you will be able to generate, hold on. It will give you a 30-day report, and we're working on the other reports right now, right? Okay, so I can't really show you that, right? Yeah, because we're, okay, right? So it's going to let you see if your frequency is going up or down or your pain is going up or down, and I think that's important for your doctor and for you. And then we'll have some educational information in there right now. It just points to the IC Network website, and then if you are interested in buying books or something like that, there's just links to our stores. That's it. We're not selling anything inside the app. We don't want to do that. So anyway, this is what's hot right now is Bladder Tracker. How cool is that, right? So we're still working on the reports and the data. I mean, to me, I just want you to have data. I want you to be able to prove to your doctor that you've got issues and that you're having problems with sleep or intimacy or whichever. Nobody's going to be studying the data but you. The data is going to live on your phone, but it's also going to live in our secure database, but we're not going to sell it. Nobody's going to look at it. I can promise you that. It's just so that if you change phones, you'll be able to back it up. So you'll be able to delete it at any time. And it's just really up to you how you want to use it. But we just really wanted to make this available. You know, because if you start a new therapy, how will you know it's going to work? So like I've told this story a few times that in my first big summer with IC, and I was being treated at UC San Francisco, and I was doing the ankle neuromodulation, I started avoiding diary because I just needed to understand more. I didn't get it. All I knew was I was peeing all night and I was in pain every day. And my pain was substantial back then. And what the avoiding diary helped me see is that the therapy I was doing was working. Slowly but steadily, it was working. If I just relied on my emotions and the fact that I was in pain, remember, when you're in pain, you forget you're having good days. You do. That's what pain does. Pain makes you focus on saving your life right now. And so I had my first 2 hours without pain at week 4 of my ankle stem, and I had my first day without pain at week 7. But if I had not been doing this, I probably would have stopped it all because I would have let the pain, the current pain that I was in, it would have made me forget that I was actually having good days. So it's important to know where you are before you start a new treatment, and then how are you going to evaluate it at the end? Like to me, the first thing that changed, aside from my pain, was my frequency. So I was peeing 25, 30 times a day. Well, that went down to 15 times a day. I was still in pain, but there was no doubt that things were changing for the better, and that tracking my symptoms really, really helped. So anyway, so this is going to be the next IC Network project, and it'll be interesting to see what you guys think. We've sent it to a bunch of doctors. We really want them to look at it and see if they would find this useful. You know, just really trying to think outside of the box here. So anyway, that's pretty exciting, but we're still fine-tuning it. All right, let's get to your questions here. So we're simulcasting live on Facebook and YouTube. So if I'm looking over here, I'm looking at Facebook questions. If I'm looking here, I'm looking at YouTube questions. Although, you know, let's see here. All right. Hello, April from Maine. Hello, Christy, who says she's struggling in Florida. I'm so sorry, honey. Sean says, I'm getting ready for sinus surgery and had to complete blood work and urinalysis. It indicated bladder infection, and I wasn't even aware of it because I've been in so much pain lately. Now it's turned into a kidney infection because I didn't get antibiotics soon enough. Just another side effect of the disease. I don't recognize when it's more than I see. That's really hard. I mean, I will tell you that the same thing happened to me. I had what I thought was a flare. It got progressively worse and worse. And, again, I was throwing everything I knew at it. Nothing was working. And then 3 months later, I was pretty much a lunatic in pain. I just drove to my urologist's office at Kaiser. I didn't even make an appointment. And I just burst into tears when I walked in. And they had never seen me cry before because I ran their support group for several years. So they knew if I was crying, it was bad. And they pulled me right back. And yeah, I had a UTI. I had no idea I had a UTI. The subtle difference is UTI causes infection. Fever. UTI causes fever, whereas an IC flare would not cause fever. Also, UTIs are really known for causing a lot of urethral burning. I did not have a lot of urethral burning with that flare. It's very tricky. And that's why home UTI test kits are really so meaningful. Having an azo bladder test strip is one way for you to differentiate if you're possibly having UTI as compared to an IC flare. Dawn says, rode an exercise bike for 15 minutes. Now I'm having extreme frequency and urethral spasms. It's hard to deal with this. It's summer. I can't leave. Yeah, but girl, you made the ultimate mistake, and that is you sat on a bicycle seat that pushed right into your pelvic floor. Okay, we don't do well on traditional bike seats. If you've got pelvic pain, you should not be on a bike unless you're on a two-bunner. There's a bike seat that's 2 round circles that where each butt cheek is you're putting your weight on, but nothing's pushing up into your pelvic cavity or into your pudendal nerve or anything like that. The only other way you could get by that is maybe with a recumbent bicycle. So you're having a pelvic floor flare. It happens. So do things that will relax your muscles, use some heat, rest, don't get on that bike again until you change the seat on that bicycle. April said, I've had 11 abdominal surgeries. Now I have IC. What is the connection? Pain, muscle tension, scar tissue, could be any one of those things. Anytime you have pain, anytime you're in pain, your muscles will get tight to protect you from pain. It's called the guarding reflex. So if you've had 11 abdominal surgeries, you've been in a hell of a lot of pain for a long period of time. And it is an autonomic response. Your body absolutely is going to try to protect you from that pain by getting tight. So your pelvic floor is now guarding. And so that would be the very first, most logical thing that we would be looking at, April, is do you just have accumulated muscle tension, that your muscles are in tension and they just have kind of forgotten how to relax? And then the other thing we would really want to look is the quality and health of your skin. Are you showing any estrogen atrophy? I mean, if you've had 11 surgeries, I have to wonder if you've had a hysterectomy, you've lost some ovaries. If that's the case, you may also now be in some estrogen atrophy, which would affect your bladder. Those would be the logical things, but there can be other things too. I mean, we've had members of the IC network, you've had surgery where a stitch perforated their bladder wall and gave them symptoms, and they had to go back in and pull the stitch out. We had a doctor with IC and pelvic pain who had reparative surgery after having a very difficult delivery. And she started passing stitches through her bladder wall because they used the wrong type of stitches. So there are a number of things that could be happening there. Let's see. Anne says, do you need pain for IC? No. The frequency urgency is triggered by the alpha afferent nerve in the bladder wall. And so the first nerves that get turned on whenever you have any sort of urinary tract issue are going to be the frequency urgency nerves, because they're meant to be easy to turn on, because they're the ones that tell you when you need to pee. Pain comes from a nerve called the C fiber. That is a hard nerve to turn on. Normally that only gets turned on after some sort of trauma. So early, if you have a mild injury to your bladder wall, or from chemotherapy, or you got mild estrogen atrophy, if it's only frequency urgency, that's great. But for some of us, the pain nerve gets turned on. And so then our question is when is the pain the worst? Before you pee or after you're done peeing? If your pain is worse as your bladder fills with urine and it's relieved after urination, that points us directly to your pelvic floor. If your pain is worse after you're done urinating, wait, I said that wrong. If your pain is worse as your bladder fills with urine and it's relieved by urination, that's your bladder wall. Did I say that right? I hope I said that right. If your pain is worse after you're done peeing rather than before you urinate, then that points us to your pelvic floor as a likely source of that pain. Hold on a sec here. Hi, Nicole. Hi, Amy. Hi, Barbara. Nice to see you. Amy says, just got my bladder stretched for IC and you're titrating off of a fentanyl patch. Good luck, hon. Good luck. I hope that that's going well for you. Fentanyl is definitely, you got to go slow and steady when you're going off some of these medications. You can't just stop them. You can't stop them right away, or you could have withdrawal symptoms. Let's see here. Just one other thing. One way of differentiating IC from overactive bladder is that sense of urgency. If you're running to the restroom to reduce pain, that's bladder wall, IC. If you're running to the restroom because you're afraid of leaking, that you're going to be incontinent, that's overactive bladder. Okay, that's how we distinguish those two conditions. Pamela says she did Kegels for years with physical therapy. Ooh, yeah, you only do Kegels if you're incontinent. You don't do Kegels if you have tension. Kegels will only make that worse. Is Hunter's lesions a bladder problem and not an IC problem? Hawk. All right, so Hawk. So in Europe, only patients with Hunter's lesions are diagnosed with interstitial cystitis. Everybody else is diagnosed with bladder pain syndrome. And that's becoming true for the United States too, slowly but steadily. So Hunter's lesions represent its own unique disease. And we call it Hunter's lesion disease. And I have a separate website for that. You can go, if you just go to hunterslesions.org, I think you should be able to go there. So we're in the process of kind of splitting the two groups apart, but there's a lot of discussion, pros and cons. Some people want to do that. Some people don't want to do that. But Hunter's lesions represent really the only really major disease process that we understand right now. Because when you biopsy a lesion, there's massive inflammation. Whereas if you biopsy somebody without lesions, the bladder wall really is not inflamed. So the only patient group in this IC subtyping system that have severe inflammation in their bladder wall is in fact Hunter's lesion patients. So what does inflammation mean? Inflammation means your body's fighting something. I mean, there's warfare. There's warfare happening down there. Your body, your inflammatory response is sending white blood cells to your bladder wall to try to defeat something. And the question is what is triggering it? And that's kind of one of the mysteries of quote unquote IC is what causes lesions. We've got some pretty good research that tells us that for some patients, lesions are the result of viral infections. Specifically a virus called the Polyoma virus. It's a virus that we all have, not a sexually transmitted disease. It's a virus that's part of the human biome. And normally it does nothing. Normally it's silent. The only time it gets turned on is in patients who are immune compromised. So for example, in patients who've had kidney transplant and you're on immune suppression drugs to try to save that kidney from being attacked by our bodies. So what they do is they massively reduce our immune response and bam, that's when the polyoma virus gets turned on. And polyoma virus is associated with hemorrhagic cystitis, bloody cystitis. These wounds bleed profusely. They bleed so profusely, they call it a bloody waterfall. And that's what Hunter's lesions do when you stretch them, is they bleed profusely. So theory number one is that it's a viral infection. Theory number two is that it's neuroinflammation, that there's some sort of neuroinflammatory response going on. Why do we say that? Because we know that if we numb the nerve, that lesions will reduce and or potentially disappear. And we learned that through the Lyris research studies. Lyris is the only treatment in history that has healed Hunter's lesions in just 2 weeks. Unfortunately, it has been shelved by the company Allergan, who has it. So Lyris is imagine a soft, hollow piece of spaghetti filled with medicine. And what they do is they put it up through your urethra into your bladder, and it kind of folds on itself so it won't slide out. So they call it the lidocaine pretzel. And for 24 hours a day, for a 2-week period, it was releasing lidocaine into the bladder. Now, it was originally created to reduce pain. And in the very first research study, they were stunned that every patient with Hunter's lesions had their lesions heal. Gone. The quote in the research study was a total and complete resolution of the lesion. And so everybody, this is about 10 years ago, got very, very excited that we have our first treatment in history to heal completely Hunter's lesions. Unfortunately, the company that invented it sold it to Allergan. Allergan is known for Botox. And Allergan had to replicate all of the research studies. And because they're such a massive company, billions of dollars, that really wasn't that big of a deal for them financially. But at some point in time, they just decided that apparently it wasn't worth it. And they shelved it like 3 years ago. And so now we do not have the one treatment in history that heals Hunter's lesions. They made the only thing they said about it was that they were deprioritizing Lyris, which means it was no longer a priority for the company. So that's one of the real tragedies that's happened right now. Now, the third thing that happened with lesions is fascinating, was in a case study we released a couple weeks ago. We had a patient who, actually not me, a doctor published a case study in one of the major journals about a patient who had Hunter's lesions disease combined with a very severe prolapse of her muscle. So in this case, if we get back to our model here, these muscles were so weak now that basically her bladder and her uterus had fallen through. So when they went in to repair the prolapse, because it was very, very severe, they could not, Kegels would not touch it. There was serious damage. What they found was that a ligament, if I put this in here, so look, if I'm putting the vagina and the uterus in here now, right? Whoops. And I don't have it all together. So what holds the vagina and the uterus in place are some ligaments, right? And so we can't see these in these models. But in her case, what they found was that one of the ligaments was torn. And when that happens, so let's say that you've lost your ligament on the right side, it twists. And that's what happened. Her vagina had rotated 180 degrees. And so what they did then is they repaired that, got everything back into the right position. And what do you think happened? She was cured, not only of her prolapse, but of her Hunter's lesions. Her Hunter's lesions disappeared. And so we're all just really trying to understand. I mean, that really shows how much we don't know, right? That we're still trying to understand that. But so the only thing that kind of makes sense to me is that in the process of twisting her vagina, that it was twisting a nerve and creating a lot of neuroinflammation. And once they restored the position, everything calmed down and she was healed. So you need to be the squeaky wheel, my friends. You need to be the squeaky wheel. Rona says you can't see the demonstration. I'm sorry, Rona. It's kind of hard to do it. Sean says, do you warm the wand prior to using it? No, room temperature. You can put it in the refrigerator in the not in the freezer. If you like cold, you can put it on a heating pad. If you like warm, I've never had to warm it or cold it. It's just sitting in my bedroom. I wrap it up in a towel and put it in a closet. Pamela says, you're getting an inner stim placed tomorrow. Pamela, good luck. So inner stim is a step 4 treatment option, also known as neuromodulation. And basically what they do with inner stim is they're using a mild electrical current to try to re-regulate the nerves that support the bladder and parts of the pelvis. And one of the ways they know if they've reached the nerve is when they implant the electrode and they attach the TENS unit to it and they turn it on, they're going to be looking at your feet. And if your big toe bends down or your outer toes splay a little bit, they kind of splay like that. So the perfect sign that you've hit the nerve is that your big toe goes down and your outer toes splay. But it might just be the splaying. They might just be looking for movement there. Hun, the only thing I want to say to you about inner stim is that hopefully you've gotten everything in writing. Make sure, you're having it done tomorrow. I don't know what time you're having it done tomorrow. You need to call your insurance company and make sure it's covered by your insurance, because we've had a number of patients who were told it was covered. They didn't get it in writing. And after the surgery, they got a bill for $70,000, $80,000. So make sure you verify in writing that it is paid. When you get to the hospital tomorrow and they put you through the billing process, have them put it in writing for you. Okay, that's important. And then the other thing too is you kind of have to be a squeaky wheel. The assumption here is that you've done the trial and it worked beautifully for you, right? And that's why they're doing, well, are they doing the trial tomorrow or are they just doing the implant tomorrow? If they're just doing the trial for you tomorrow, they're going to surgically implant the leads. They're going to leave the box externally. You'll have it for 2 weeks. They're going to evaluate your symptoms. If you have a good response to it, then they will implant the generator into underneath the skin by your hip or in your butt cheek. But you need to be very verbal, very vocal with them. Let them know if anything feels weird. You should not be shocked. There should be no shocking sensations, anything at all like that. It would be abnormal. You should not have pain from that neuromodulation device. So if you get a shocking sensation when you sit down, if you get a shocking sensation when you have a bowel movement, if you're walking and you randomly just get shocked, that's a sign that something's wrong. Okay. Pamela says, what about the Mona Lisa? I did it. Mona Lisa has mixed reviews. It's really one way of trying to regenerate some tissue in your vagina, but the FDA did issue a warning about laser therapies in the vagina and some patients getting laser burns. Bobby says BCG installations were great for getting rid of bladder cancer. Absolutely not one problem. It was one BCG 4 months later that pissed my bladder off in April 2019, but you're cancer free. So Bobby, you just nailed it on the head. So guys, let me get this model here for you real quick. Hold on. Ow. My thighs get so stiff sitting here. I should be standing. So let's look at this. This is a side view of the bladder wall, right? And this is an old Elmeron side view. But really what I want you to see is you've got a top mucosal barrier. Obviously, it's not blue, it's clear, but this is for educational purposes. Then you've got a layer of urothelial cells. Then underneath the urothelial cells, here we've got our blood vessels and nerves and mast cells and things like that. Now, bladder cancer is considered one of the easiest cancers to treat. If your bladder cancer is just here and it has not gotten deeper into this area or into the smooth muscle of the bladder, A treatment like Bacillus calmette-guerin, also known as BCG, will literally just strip this off, strip the cancer cells off, you pee them out, a new healthy lining grows, and potentially you're cancer-free. And there's, again, bladder cancer is considered the easiest to treat with the best prognosis for any of the cancers in the human body. The challenge is if the bladder cancer gets deeper than that, then they might need to go in and resect it out or something like that. BCG was studied as a therapy for IC by Royal Oak, Beaumont Health up at Royal Oak, Michigan. And what the data showed was that BCG really did not provide any meaningful response with respect to IC and bladder wall health other than with cancer. And so BCG is not considered a bladder therapy for IC. Pamela says, Elmeron, I did still have medicine. Stu says, my pain is primarily my urethra and the canal. Isn't pelvic floor, is it? Yeah, it could be easily because look, hon, look. These are your levator ani muscles, right? These are the lowest muscles. Your urethra right here is surrounded by muscle. Your vagina is surrounded by muscle. And if these muscles are tight, you're not going to be able to pee easily. You're not going to be able to enjoy sex, and you're not going to be able to have bowel movements easily because the muscles are squeezing the way it comes out of the body. Right? So that is pelvic floor. Sean says, how can we get a beta tester for the app? Sean, if you email me, I will make it happen because I'm looking for some beta testers to do it. I've been beta testing it myself. Pamela says, I pee all day and night. I have an emergency card and they roll eyes. They won't let you into the bathroom. Yeah, that's why we have we have restroom alert cards. We have our red and white restroom alert cards, which, let's see if I've got one that's easy. Where are my restroom cards? Where are they? Oh, here you go. Here you go. Medical alert, restroom access required. You can carry this card with you. And it says the holder of this card has a medical condition, interstitial cystitis, prostatitis, or pelvic pain syndrome that requires frequent and urgent restroom access. It is difficult, if not impossible, for this patient to hold it without enduring severe pain or bladder spasms. Please provide restroom access to this patient. Your cooperation is greatly appreciated. You can get these. I'll tell you what, if anybody wants these cards, I'll mail you a free one. All you need to do is send me your mailing address, icnetwork@mac.com. If anybody wants a free medical alert card, I'll have to get some from my warehouse because I don't think I have that many, but I would be happy to send these out for free to anybody who wants them. So icnetwork@mac.com. Send me your mailing address for a restroom card, okay? I also have diet cards. I'll throw a diet card in there too. Bethany says, does Piora help with TMJ? No, I don't think so. Piora is really about calming nerves down. So I take the Piora to help my skin be less sensitive and my bladder to be less sensitive. For the TMJ, it's all about muscle tension. And man, when I woke up this morning, it's so weird. I do not understand why my neck gets tight when I'm sleeping, but it does. Donna says, I have Hunter's lesions, having a flare right now from lifting wood we tore down last weekend. I had a feeling of something falling out of me and you almost blacked out while immediately went to the ground from pain. Holy crap, girl. Finally got to see my doctor last Thursday. He said my urine is fine. Maybe get with a GI doctor. No, honey. Whoa, hold on a sec. I have this happen to me when I lift things. I'm the one with 2 bladder augmentations done. Ooh, I've been hugging a heating pad all week. Girl. Yeah, it's challenging. Anytime you feel that sensation that something's falling out of you, God, we really have to look at muscles, hon. That's the classic symptom of pelvic floor dysfunction. is that muscles are getting weak and they're falling. I'm stunned. Have you had physical therapy yet? I would think it would be fascinating to know what the health of your pelvic floor is, given the fact you've had two bladder augmentations done. Do not, again, feeling like something's falling out of you is not a bladder symptom. That's a pelvic floor symptom, that your pelvic floor is weakening and things are starting to fall. And it happens. So it could be your uterus that's starting to fall, or it could be your bladder that's starting to fall a little bit. But the cause of it is usually very weak muscles. Danielle says, when do I think it'll be available? Hopefully in a couple weeks. Judy says, what causes bladder spasms? So you guys, you have to remember you have two different types of muscles in here. So you've got the skeletal muscle of the pelvic floor, and then you've got the smooth muscle of the bladder. And they're chemically, biologically distinct and different types of muscles. So if you're having a pelvic floor spasm, a skeletal muscle, at least when I had them, it felt like somebody was trying to shove something really wide up my urethra, up my vagina, or that there was a hand up my vagina trying to pull my stuff out of my body, this very distinct pulling and pushing sensation. In contrast, bladder spasms, they usually happen as the last couple of drops of urine are coming out. And there's kind of, again, two theories of it. Theory number one is that, normally your bladder gets full, and then as you urinate, it starts to contract. And one theory is that the walls touch and they shimmer or shiver when they touch like that, and then eventually they pull apart again. That's kind of one theory of a bladder spasm. The only time I've had bladder spasms was when I had that 6-week UTI that we thought was a flare. That's when I had bladder spasms. And for me, it was as the last couple of drops of urine were coming out, I just had this very violent pain that shot up my spine and down my legs. And I was just like, it just made me do this, and I was sitting on the toilet like this for about 3 to 4 to 5 minutes until that spasm stopped. The cool thing about bladder spasms is we can stop them with a smooth muscle relaxant, also known as ditropan or Detrol. And they will stop bladder spasms in about 20 minutes. So if you're having bladder spasms, you would ask your doctor for a smooth muscle relaxant, usually ditropan or Detrol. Debbie says, I have a lot of urethral spasms and pressure with pain escalating. So again, with urethral spasms, again, it could be bladder spasms, but it could also be levator ani spasms. Debbie, does heat make it better? If heat makes you feel better, heat relaxes muscles. The other thing would be using a muscle relaxant, like baclofen or Flexeril, if that helps with that spasm. Danielle says, I buy Azo maximum strength, but I'm afraid to take them. Is there any dangers from taking them? Honey, Azo bladder pain relief tablets are the generic version of pyridium. Pyridium has been used for years to numb the bladder wall. It's a stuff that turns your urine orange. So they would not have been given approval to do an over-the-counter version if it was not considered remarkably safe. The only challenge with it is you're just not meant to use it for a long period of time. Generally, people will use it for 3 to 4 to 5 days. It's not something that you would want to do every day for 2 years. Anne says, I was told you have overactive bladder, not IC, but you have no leakage. Well, that's interesting. You're in that challenging in between the two conditions. What that tells me is that your alpha afferent nerves and your bladder wall are being irritated in some way. Now we got to figure out why. Are they being irritated because your mucosal barrier is thin because of estrogen atrophy? Or are they being irritated because you're doing some sort of chemical stimulant that contains caffeine? Or you're eating or drinking something you shouldn't be doing? Joan says, hey, Jill, I get that toe-free splaying of toes and drop of the big toe. I do not have interstim. Really? Joan, that's fascinating. I don't know what that means, but the fact that you get your big toe dropping, your outer toe splaying, that then what that implies is that nerve is being compromised in some way, probably by tight muscles. Hi, David. Joan says, your neck and jaw are tired because we clench or grind our teeth at night. Anti-inflammatories and soft diet for 2 weeks. If symptoms do continue, go to a dentist. Honey, I fractured my 2 front teeth from this. They're still a little tender, and I wear a big giant mouth guard. It's just how my stress is in my neck. You know, we all present our stress in very, very different ways. See, and you have to do this Tmj exercises. My neck and my shoulders are so freaking tight. Like I'm always working on it. Always. One of the things you do with TMJ is this. You know, there's a lot of exercises. I do them all. But for me personally, I just hold my stress in my neck. It's been tight for years, decades. I also have a trigger point right here. Oh, it's good today. Oh, that's good. Hey, that's one good thing that happened. Pamela says she'd love a bathroom access card. Pamela says, I ordered IC 101, by the way, and I love it. Lots of great information. Oh, I'm so glad, guys. We have our new book, IC 101. It's not just a bladder disease. It was released a couple weeks ago. Getting ready to print up some more. We're almost sold out. And I've been wanting feedback. I need to get them on Amazon. I still haven't done that yet because I've been working on it. I had to get our magazine out and all sorts of stuff like that. I'm also redoing our diet guide. It's going to be the IC 101 diet guide, and then our flare guide, the IC 101 flare guide. They're going to be companion pieces to the book, and the diet guide I'm working on right now. It's about 80% done. Lou says, can we have both IC and pelvic floor? Absolutely. It's called the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved. They cannot not both be involved because they are so incredibly interconnected. But one is normally driving the other. So for some of you, IC can begin after a direct bladder wall injury. So let's say you're going through chemotherapy and the chemicals of the chemo are irritating the hell out of your bladder. Because your bladder is screaming in pain from the chemical burn, your muscles are going to get tight to protect you from that chemical burn, right? So our therapeutic priority for the chemotherapy patient is to calm and soothe the bladder. And we know that when we can get the bladder to stop screaming, the pelvic floor should release. That makes sense. But what about the patient whose symptoms began after falling or having a baby? So let's say you fell on your tailbone. Which is a very common injury in this patient population. Now, you have no freaking clue that you've hurt yourself. You know, that you knew you fell. Yeah, you knew you rubbed your tush because it was sore when you fell, but you didn't necessarily know that there were any long-term issues with that. Oh, I'm getting a warning here. We have a low frame rate on Facebook. Egads, guys. I don't know if I can do that. Please set your frame rate to 15 to 60. I don't know how to do that. Stream setup. Here, hold on. Nope. Inside dashboard, stream help. Oh, that's a really low frame rate. Okay, well, I will try to figure that out. I'm sorry. Facebook, I'm sorry. You're on your own internet. You're not, I've got 2 different internet services. So you are on Xfinity. No, you are on AT&T and you are on YouTube's on Comcast. So, okay. So anyway, let's get back to this muscle injury patient. So again, you fell, you fell, you had some bruising, and and a week later, all of a sudden you got symptoms of frequency urgency. You have no clue you have a muscle injury. You think you've got infection. Because the bladder only knows one language: frequency, urgency, pressure, pain. The only way they can bladder tell you there's a problem is by giving you the symptoms of a UTI. You could have a bullet wound and it would feel like infection. You could have a stab wound and it would feel like infection. Everything feels like infection. All right. So you call the doctor and you're like, all right, you know what? I think I have an infection. The doctor goes, okay. They give you antibiotics. They don't work. You go back to the doctor. The doctor goes, well, we better do a more aggressive urine test. Urine test comes back negative. But some doctors will say, well, you know what? Why don't you just go on antibiotics anyway? It's probably infection. So you go on antibiotics for several months, 6 months, a year. They don't work. You go back to the doctor. And the doctor goes, you know what? Maybe you've got overactive bladder. Let's put you on overactive bladder medications like ditropan or Detrol. So you do that. 6 months, 3 months, 6 months, a year. Doesn't work. And now you got pain. Now you got big pain. You got pain as your bladder's filling with urine. You go back to the doctor. You're crying in pain. The doctor goes, God, I hate to break it to you. I hate to say it, but I think you might have this incurable bladder disease called interstitial cystitis. Here's a diet. Go look it up on the IC Network website and read about it. And you're on your way home going, oh my God, I've got this incurable bladder disease. And then you do Elmeron. You do other bladder therapies, and you're doing them for 3 months, 6 months, a year, 2 years, 5 years, 10 years. You're on Elmeron and you don't get better. And now you might be going blind because of the Elmeron, right? Here's the reality, is that no bladder therapy is going to fix you if your symptoms started after an injury. That our therapeutic priority for somebody whose symptoms started is to restore blood supply, because you have sustained what we call a compression injury. So when you fall, bam, the muscles that you fell on were squeezed, right? They were injured, they were damaged. 200 pounds, bam, right on this small group of muscles. So we know the muscle tissue is damaged by a compression injury, but we also know blood vessels are damaged by the compression injury because you get a bruise. Because when you fell, you broke the blood vessel. So we know that's happening. But also the other thing that gets injured when you fall is the nerves. And the nerves are injured because they lose their blood supply. Nerves require blood supply to function correctly. If you've broken their blood vessels, the nerves are now dysfunctional and not normal. And so what do we see? And then God forbid it's so bad you end up with a giant trigger point. And a trigger point is a long-term compression injury. And so let's see here. So this is the book that everybody should get if you think you have a musculoskeletal cause for this. This book, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss, is a total game changer. And he's the one who explains what happens with compression injuries and what happens when you fall. And he's got an excellent chapter in here on trigger points. And let me find that for a moment. I want you to see this. Okay, so look at this. So a trigger point is a muscle knot. So normally your muscle, the human body's amazing. It's absolutely amazing. It's remarkably adaptive. Think about it this way. Your bladder stretches and contracts. That's kind of miraculous in itself. But how muscles work is interesting too, because muscles that are at rest have fibers that go both directions. They're horizontal fibers. And they're like this. And then when you stretch them, I got that backwards. Okay, hold on a sec. Muscles at rest are like this. They're like this. And then when you contract them, they slide together. And they have little tiny pili, little tiny hooks on the muscle fibers that attach to each other. So I'll show you my absolutely pathetic bicep right now. So this is an example of a muscle that's at rest. But if I pop my bicep, you can see it contracted. My little bicep right there. That's because the muscle fibers slid together and now they're locked together. But it would be very hard to hold this for a day, a week, right? That's not normal. Your muscles are supposed to be long and lean. But you can get trigger points where that happens. Small areas of muscle that are basically stuck together, the pili are together. And this becomes a long-term compression injury. So now we've got a trigger point that is impeding blood flow over a significant period of time. As long as that trigger point is here, this muscle will never be healthy and the blood supply will never be healthy. And so our therapeutic priority for somebody whose symptoms began after injury is to restore a blood supply with pelvic floor physical therapy. And we learned in 2008 when the National Institutes of Health released their study that pelvic floor physical therapy outperforms bladder therapies in terms of making IC patients better. And that exactly was when the IC movement was put on its head, because up to that point, everybody's going bladder, 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 bladder. And we're like, well, wait a second. If it were bladder, 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 then why would pelvic floor physical therapy reduce symptoms? And now we know that it absolutely reduces symptoms. And that's why every single patient who's getting diagnosed today, literally the most important thing for them to do is to test your muscles. If you've never had your pelvic floor checked, that is a huge mistake. And the next time you go to the doctor, whether it be a urologist or a gynecologist, have them touch your muscles. And if your muscles are tight, we need to work on those, and God forbid you have trigger points. And again, that's why having a glass wand is so useful, because if you've got a trigger point, as I do in my piriformis muscle up here, I can use the wand to push on the trigger point and try to get it to release. Remember, if you have a muscle knot on your back, as so many of us get, what do? You have somebody push on it. When you push on it, the muscle fibers usually release and the trigger point goes away. So again, this chicken versus the egg dilemma. The bladder and the pelvic floor are both involved, but one is driving the other. And that's what we got to remember. We got to figure out. Because if your symptoms are being driven by your muscles, you could be on bladder therapies for years and never get better. We want you to get better. And that means physical therapy. We have to work on the health of the muscles. The bathroom access card is in the IC Network store. It's in the IC Network shop. Just go to our website, icnetwork.org, and it's right in the pull-down menu. Joan says, what about hysterectomy? Could that cause IC? Hysterectomy is going to really F with your pelvic floor muscles. Take it from somebody who's been there. So, so number one, your pelvic floor muscles are absolutely going to be traumatized by the surgical procedure. But the other thing that's happening with hysterectomy is if they took your ovaries, you're now in estrogen atrophy, which means your bladder wall is going to be thin. And let's look at what happens. So again, here's your nice thick mucosal barrier. It's in this blue, right? But unfortunately, that's estrogen dependent. So when you're young and you have lots of estrogen as women, you have lots of mucus and you can get away with drinking Cokes and stuff like that. When you're older, guess what? You don't have a lot of estrogen anymore. So this is what happens. The mucosal barrier starts to thin, if not go away. This then allows whatever's in your urine to reach these more fragile cells. And that's why older women will have symptoms of cystitis, because they're dry, whatever's in their urine's getting down there and it's triggering their nerves. So therapeutically for them, what we're going to do is give them something that will give them an extra coating in their bladder. And that you can see that this is what Elmeron did I mean, this is probably 20 years old. When did they make this? March of, yeah, this was made in 2005. So they're 18 years old. So this is what they thought Elmiron did, is that it created a chemical coating. But now, of course, we know that Elmiron is linked to eye disease. So Elmiron is not being used to the degree that it was before. Instead, you can do a coating through an installation where they can put heparin directly in your bladder to coat your bladder with some lidocaine to numb the nerves. Or you're going to be doing a chondroitin-based supplement, because we have research that proved, the research that was released last year that proved that chondroitin was the most effective at restoring the superficial integrity of the urothelial cells. And so those supplements are going to be Bladder Builder, Bladder Rest, Cysto Protect, Cysto Renew, or Cysto Mend. Those are the 5 core chondroitin supplements that IC patients will usually try. Bladder Builder is the best supplement on the market because it has the most methods of action. So it will not only provide support for the bladder wall, it's got an antihistamine in it, quercetin, which is an antihistamine. It's got some beneficial probiotics in it, but most importantly, it has a pain-reducing ingredient called PEA, also known as palmitoyl ethanolamide. So we look at Bladder Builder, and Cysto Mend is like Cysto Protect, but stronger. So we look at Cysto Mend, Cysto Protect. And for those of you who are uber sensitive, and you don't want to take anything because you don't know what the hell, how your body's going to react to it, the supplement that is kind of the cleanest in terms of formula, has the fewest ingredients, is really Bladder Rest. And that's actually one of the best sellers. Let me just show these to you. Let's see. Where is my Bladder Builder? What happened to my Bladder Builder? Oh, you know what? I think I sent it to somebody. All right, so I don't have a bottle of Bladder Builder. Oh, no, here it is. Here it is. So Bladder Builder. We did a 1-year follow-up study with this. 60% of the patients who tried it love it. They're still on it today. They're reporting far less pain, fewer flares, shorter flares, less painful flares. Where is my... Okay, I don't have Cysto Mend. I definitely sent those out. Cysto Mend is also out there, but it doesn't have the PEA in it. And here's Bladder Rest, which is kind of, again, the really simple formula for people who are really, really sensitive like I am. And then we have Cysto Protect. This is the new label for Cysto Protect, but we're still going to have the turquoise labels for probably another year. So if you're a Cysto Protect user, you're going to switch between yellow labels and turquoise labels, just so you know, until they get rid of all the turquoise labels. There's about 8,000 bottles that they've got to sell. And then Cysto Renew. This is not as popular anymore. Bladder Builder definitely kind of took the market, so to speak, but this is also another option. So those are our favorites. And if you like aloe, aloe has a soothing effect on the bladder wall. And the aloe that I really like is called Aloe Path, because it's not just aloe, it also adds the PEA in it. So you can't get a double whammy of the soothing effect of the aloe combined with the pain-reducing properties of the PEA. So Aloe Path is viable. And then for those of you who your bladder wall is healthy, like I am, my bladder wall is healthy, but you've got uber sensitive nerves and you just want to try to calm the nerves down, Piora, Peaora, Piora. That's what this would do. This is the same formula very similar formula to the formula used in the IC research study, which found 2 years ago that 87% of IC patients who use this or used a formula similar to this in Europe, 87% reported a significant reduction in their pain by month 3, and by month 6, 20 to 25% of them were completely pain-free using a PEA product, and the rest were doing remarkably better. The cool thing about the PEA is that it's absolutely one of the best tolerated supplements of all, because it's a simple fatty acid. And so no side effects reported in the great majority of 99% of the PEA studies. They've studied it with sciatica, fibromyalgia, you name it, they've studied it. David said, he just ordered Piora. Awesome. It'd be interesting to see how you do with it. Afton says, can pelvic floor dysfunction cause an itching sensation internally, like around my bladder, ovaries, pelvis, all over really? It's not vaginal itching, it's more inside. This is a new symptom for me lately. Honey, Afton, if it's pins and needles, like you're being poked and prodded, especially if it were on your skin, like on your vulva or around your rectum, I would definitely say pudendal neuralgia. But the fact that you're having an itching sensation in your bladder, ovaries, pelvis, I don't know, hun. I mean, I think you need to talk to your doctor about that. It kind of makes me wonder if you got some endometriosis going on. I don't know. Ravonda says, will IC101 be on Audible? Yes, it will be eventually. I just have my to-do list is giant. It's massive. I often said, I have pelvic floor dysfunction. I've been going to physical therapy for several weeks, and I'm feeling a lot better with many of my symptoms. One thing that is new is an itching sensation internally. It is after I urinate, and it's all over my bladder and abdomen. Could this be trigger point related? Maybe. I mean, it sounds like it's nerve related. I think you need to talk to your physical therapist about it. I mean, everything is adjusting now. I mean, for many patients, their muscles have been tight for years. And so when you start physical therapy, you're beginning this cascade of things that are changing in your pelvis. Donna, I'm not sure what you're asking about. That. Are you talking about the app? Will it be free or it costs for us? It's not going to be free because it's cost us $20,000 to build. So we're going to be charging for it. $20,000 to build an app. Can you believe it? Chloe says, I was taking Azo like candy until I found out it causes dementia. I don't remember seeing, I thought that Azo used long-term caused liver problems, liver or kidney problems. I don't remember seeing that it caused dementia, but it wouldn't surprise me. Kat says, are migraines part of my IC? Migraines are part of what we call the chronic overlapping pain condition group. So if you've got IC, IBS, vulvodynia, TMJ, migraines, your diagnosis is chronic overlapping pain conditions. That's my diagnosis. Chronic overlapping pain conditions with some SI pelvic floor thrown in there too. And so, yeah, easily. Let's see. Joan said, you have your ovaries, but you were put on estradiol, but your IC started 9 to 12 months after. Well, then listen, as somebody who's been through a hysterectomy, my pelvic floor has not been the same. I went through 10 months of pelvic floor spasms, levator ani spasms, and I have something called vaginal apex pain, which is at the top of my vagina where my incision is, where they took my cervix. It's very sensitive. And my muscles tweak out like mad on occasion. So we really, don't assume that your muscles are healthy after a hysterectomy. I think it would be important to have that checked. Soledad says, are there possible treatment for chronic bladder inflammation caused by recurring UTIs? Installations, corticosteroids, and supplements don't work for me. Hydrodistension made my bladder worse. Well, Soledad, number one, are you still having recurring UTIs? And if so, what was the UTI? There's a group of women who do get recurring UTIs after menopause. And a huge part of treating those recurring UTIs is making sure that you're using estrogen to toughen up the tissue. Because here's the deal, is that not only does the loss of estrogen allow irritants in urine to reach here, but it makes it much easier for bacteria to infect your bladder wall. And so they would always, if you're of a certain age and you're getting recurring infections proved with cultures, a huge part of that therapy is always going to be topical estrogen if you're a candidate for that, because what does that do? That helps your tissues produce that nice thick protective coating that will repel infection. In the research studies done, I attended a class taught by Dr. Anthony Schaefer years ago about recurring UTIs. And what they found was that about 24 hours before that infection arrived in the bladder, it was actually living very happily in the vagina. And that made the researchers then ask the question, well, what's happened to the vaginal defenses? Why has the vagina become a safe haven for bacteria? And again, it comes right back to estrogen atrophy, as well as some pH changes which occur. In addition to giving you the correct antibiotic, normally they would also give you a topical estrogen to use vaginally to improve the defenses of your vaginal tissue. I mean, Soledad, I think that, we have a 6-step treatment protocol. It would be very interesting to see how you did with something like Bladder Builder that would perhaps give you the chondroitin for your bladder wall along with the pain-fighting ingredient to calm the nerves down. That would be interesting. Lindsay said, would the Piora work for pelvic or nerve calming? That's what we believe. No, it's not just the bladder, hun. PEA has been studied with pain throughout the body. PEA is remarkably successful in reducing chronic pain, and the general consensus among the researchers is it's the best for neuropathic pain. So it's been studied. It's been studied with IC. It's been studied with fibromyalgia. It's been studied with sciatica, with burning mouth syndrome. And so I don't take it for nerve pain in my bladder. I take it for all the small fiber polyneuropathy I have in my skin, where, it was very hard to go to sleep sometimes, just randomly. I'd have one night where it'd be really hard to fall asleep because I'd get all these pinpricks. Like I'd get hit with a pin here, and then I'd get hit with a pin here, and then hit with a pin here, and then hit with a pin here, all in a minute. And it's like, what the hell is going on with this crazy body? And that's small fiber polyneuropathy, which is a central component of chronic overlapping pain conditions where just the smallest nerves in your body have become more sensitive. Mary Jo says, I need estrogen, but I had a blood clot, so my GP doesn't want me to. Hard decision. Well, I can certainly understand why they would not want you to do oral estrogen for sure. The question to ask your doctor would be, would topical estrogen be as risky? Could you use, a little tiny pea-sized drop of topical estrogen, maybe by your urethra or something like that? Ask it, Google it, topical estrogen safety blood clots, and let's see what the research says. Summer says, do these supplements primarily help with pain or urgency as well? That is my primary symptom. Well, the supplements that contain chondroitin are believed to have a coating effect on your bladder, and that then protects the nerves and prevents them from being triggered. And so they are believed to kind of function like this, just like the Elmeron would, where they'd give you a protective coating in there. And again, what the research showed was that chondroitin was the most effective as a coating. And so if you if you protect these tissues, then both the nerves, the alpha afferent nerves that control frequency urgency, and the C fiber nerves would both potentially be protected and not as irritated. Jackie says it's unfortunate that these supplements are not covered by any insurance. Yeah, I know, hon. Well, you know, that's one reason why Jackie, she says she's taken several and can't afford more. That, again, is why Bladder Builder really is our best supplement, because it's the equivalent of, you know, a Cistro Protect and or Bladder Rest combined with PEA in one pill. And so you get more methods of action for one price rather than having to buy a lot. That was kind of intentional to make it a comprehensive formula. Deborah said, I had my 7th hydrodistension procedure. This time I got a bad UTI from it. Been a week and a half and still have pain from the UTI. Is this common? Well, it's not common to have 7 hydrodistensions, hon. Why are they doing that? Anytime you introduce an instrument into the urethra, you are potentially introducing bacteria into the bladder. Pamela says, is it okay to take Bladder Builder and Piora together? Yes, the company designed it so that they potentially could be complementary, but you wouldn't need to take a full dose because Bladder Builder already has PEA in it. So you could potentially, you know, maybe add one more if you wanted to give it a try, see how you do. I wouldn't, you know, here's the thing, guys. Desperation drives really funky decision-making. And I've talked to some patients who order everything and they're taking they're just taking everything they can take at all one time, whether it be the Elavil or the Elmeron or the Vistaril and the supplements. And before you know it, they're paying $1,000 a month for stuff. And that's not affordable for anybody. And so I also come from a less is more perspective because I am so sensitive. I don't believe in taking a lot of anything, because if you do that, you're not going to know what's working for you. You're not going to know what's working for you. So it's important to kind of pick one and stick with it for a period of time, maybe 6 weeks, 2 months. And then if it's helping, great, keep on. But if there's room to improve, then maybe you could add something else on top of that. But don't slam your body and take a massive dose of everything at the same time. Odds are you're going to have a reaction to that. Elizabeth says, so excited for the app. Oh, I'm so glad, hon. It's something we've wanted to do for some time, and it was just lucky that it was just kind of good circumstances that allowed us to find an incredible app designer who's not charging us full price, but it's still costing a lot of money, combined with the resources to be able to do it. And so that's why Natural Approach Nutrition is helping it, because, you know, for me to put $20,000 into an app, that would be a lot of my of our money. And apps are, you know, we have our diet app, and they eventually pay for themselves, but it takes time. That's a big hit, as you know. All right, so we would normally start our Zoom portion of this meeting, and so I'm just going to go ahead and do that. In the Zoom portion of our meeting, this is where you can come and talk to me. Let me go ahead and get that up. So if anybody has personal questions they want to ask, this is your chance to come in and do it. If you want to do it, that's fine. If you don't want to do it, that's fine too. I got no sweat in this. I'm happy to do it, but I'm also happy not to do it. It's entirely your choice. So let me grab our invitation. All right, YouTube, let me post the invitation in our chat here. I'm going to let you in one at a time for anybody who does come in. Sometimes we get 12 people, sometimes we get 1. It's entirely up to you, my friends. Entirely up to you. All right, so YouTube, here is your invitation. All right, Facebook, let me give you your invitation. Hold on a sec. You're on a different computer, so I got to go get it. All righty. So we are in our first red flag alert today for fires. Not happy about that. Starting at 5 o'clock tonight. So send us good vibes for the next 24 hours. The life is crazy right now. All right, Facebook, you have your invitation in there too. All righty. So let me just do this, do this, do this. All right. All right, let's go back to your questions. And again, if you want to come, if you have questions you want to talk to me directly about, this is your chance to come into the Zoom meeting and ask questions. People will hear you. They will not be able to see you unless they too are in the Zoom meeting. And it's really educational for others. So please think about doing it. Pamela, would you recommend Bladder Builder alone to start with? Yeah, usually. I mean, the only time that we would not suggest Bladder Builder is if you flare when you take probiotics. If you flare when you eat yogurt or when you take acidophilus, then Bladder Builder is not for you because Bladder Builder also has probiotics in it. The reason why some probiotics trigger flares is because there are certain strains of beneficial bacteria that trigger a histamine reaction. But if you have no problems with yogurt, no problems with acidophilus, then yeah, Bladder Builder is the way to go. Hey guys, let's take a quick bio break. What does that mean? Time to go potty. Give me a minute. I'll be back. Go get your drinks. Go to the bathroom. We'll be right back. All righty then. Hello, my friend Donna. Oh, what I do with my glasses? Hello, they're right there. That's pretty funny. Thank you, Pamela. We appreciate it. No clouds in the sky yet. They're telling us that it's going to come in tonight. But then apparently the winds might have shifted, so we'll see. Hey, Donna, you just hanging out?
I'm trying, baby.
Are you trying to get your camera?
Yeah.
There you go. I just sent you a command. Let's see if that works.
Okay, baby.
Deborah, thank you. Deborah says, thank you for all that you do. Yeah, you know, I love my job. I love my job. I will tell you at some point in time, I will have to sell the IC network because I will need a retirement fund. But I will always be working with patients. But, you know, it's not like I've got a big 401k. So that's life. How are you today, Donna? How is life?
am I there with you?
You are. I see
Can you
you.
hear me?
I
Can you hear
can.
me?
I
You know
can.
what's, let me, you know what's so funny? I can't believe it's just the two of us here because that's just like, are you serious? It's like a phone call. You know what I'm saying?
That's okay. That's okay. How are you? How you feeling?
You know, I'm hanging in there, girl. I got vulvodynia. I got, and it's really just kicking my butt sometimes. You know what I'm saying?
No.
I know, but it's okay. You know why? Because I know it's overlapping
Right.
chronic conditions. I know that. I
Right.
understand it, and I'm trying, and I think that I try to find the formula to deal with it.
Right. Okay, so there are three things you have to consider with your vulvodynia. Okay, and number one, first of all, I got to tell you, you're beautiful.
Oh no, no! I got my hair cut. Did you notice that I got my hair all?
I know, but you're glowing. You just look so beautiful.
Stop! You're beautiful. You know, you're my sister. You know, I love you so much. I know.
I wish we were close.
I try to stay away from that on the.
Hey, you know,
but I can call you. You know, it's so funny, Jill, because I can call you and talk to you for hours, and it's like, no, I'm not wasting her time.
Oh no, you're always welcome.
But I know, but there's other people out there who need you more than
I know.
I don't want to. You know what I mean? I shouldn't say they need you more than I do, but their problems are so much more substantial. And so for me, what I wanted to say to you was that for the first time in 4 years, I'm going home to see my mom in Dayton.
Oh, nice.
And the reason why I wanted to chime in, looking crazy or not, was because of what you said last week. And you were talking about success stories.
Yes.
And what I wanted to drive home was that I wanted to start out with you by saying, this is part of my success story.
Yeah.
I'm going to do it. For anyone out there who thinks that, oh no, I don't want to do it. Oh no, I don't know if I can do it. Oh no, I'm letting you know that I don't know if I can do it, but you know what I'm going to do? I'm going to try. And I'm going to take the skills that I have and that I've learned from Jill and I've learned over the years from my education, and I'm going to go. I'm going to get on the plane to Dayton, Ohio. It's up and down. It's like an hour and 20 something minutes. I have a good friend who's going to pick me up. I'm going to see how things are going to go. And I'm going to try to move on. Because you know what? I've not done this because I've been not necessarily afraid, but I feel like, you know, for 3 days, I'm good. 2 days, I'm terrible. 4 days, I'm good. 1 day, I'm terrible. And I start thinking, you know what? You may be that one day that you travel may be the best day of your life. And when you get there, you're there.
Yeah.
And then you calm down, you get yourself together, you bring your skills back to the way that they should be.
Right.
And then you move on. And then you know what? I'll deal with it when it's time for me to come back. And I want to talk about that success story when I get back.
Good.
And I want everyone else to know that, you know what, no matter how much pain you're in, no matter what you're going through, think ahead. You can do it. Don't be afraid to do it. And I want everyone to know that I'm going to take that leap and I'm going to do it. And when I get back, I'm going to come back on Zoom with Jill and all of you IC family and let you know what happened to me, because I think that's so important. Don't stop your life. Don't do it, because I feel like if you let IC stop you, or pelvic pain stop you, or whatever the new IC guideline is, if you let it stop you, no, you're not living. You have to live. You have to live.
Well,
people with cancer, people with all those other diseases, they live too. So with IC and pelvic pain and chronic overlapping conditions, we can do this. And it's just a matter of putting the metal to the pedal, or the pedal to the metal, and getting it done. You know what I'm saying, Jill?
Absolutely.
I started thinking to myself, if I can go there for up and down for an hour and 28 minutes, then gosh, I can come see you for like, okay, 3 minutes. I don't care. I'll take my iPad and do what I have to do. But I'm going to eventually come see you, girlfriend.
Oh,
you don't believe it, but I'm coming to do it. I started thinking, you know what? COVID has overtaken us. And you know, me being African American, there's so many other things that are trying to overtake us. And I start thinking, you know what? No, 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 no. I'm doing it. And I'm telling you, IC family, you can do it too. You can.
Yes, you can. Here, hold on one sec. Somebody needs a password really quick. Hold on one sec. And let me give that to you.
Get them in here, please, Jill.
Okay. Here, Facebook. Let me type it in here. So here, hold on a sec. Okay, I'm typing your password in. It's 8JY6HU. 8JY6HU. Okay, so okay, Facebook, there's your password right there. Okay, so Donna. First of all,
Yes,
you are an inspiration every single day. All of you are.
you are.
I mean, guys, listen, we are in this together. Everybody watching
we
right
are.
now, we are brothers and sisters in this. None of you are alone. We are here.
Yes.
We stand with you. We walk with you. Whenever you're going anywhere you don't want to do it, just pretend I'm walking right next to you, because believe me, I am.
Amen.
I
Amen.
am. And it is the support that we give to each other, and the love that we give to each other, and the courage that we give to each other, and most of all, knowing that you're not different. You're not a different person. You're not less worthy. You're not being punished. It's none of that crap. You're hurt.
Yes.
And a lot of us are hurt. But you know, like, so John, I've been thinking about this, and it really rang true to me yesterday, because I had a Zoom meeting with some high school friends.
Okay.
And we were originally going to get together, and now COVID is really bad in our county again, and they just issued new warnings. You're not to be gathering in anybody's homes, even if you're vaccinated, because COVID is the Delta variant spreading in my county pretty severely. So we decided to meet online. And I have one very, very dear friend who was there was no joy in her life at all.
Yes.
It was just COVID and fires and work. COVID and fires and work. And, you know, for us to be healthy, we've got to be healthy physically, mentally, and emotionally. And we have to have that joy in our lives. And we have to have that I mean, we have to be balanced. If you're living in fear,
yes,
yeah, that's an early death. You know, I mean,
yes.
that's we've got to remember that IC is below the waist. If you've got a bladder injury below the waist, okay, but you still got your noggin, you still got your heart,
Yes.
you still got your soul.
Yes.
IC is not going to change your ability to love somebody. It's not going to change your ability to be a mother, a sister, a brother, a son, etc. And you can't let it. You can't let this push you into a bedroom where you've shut the door and you're sitting in the dark. You can't do that.
Yes.
You got to open up the door. You got to get out, and you got to let people know what you need, and you got to look at the sunshine again. Yes. Physically, mentally, and emotionally, and make these connections again. And I think that's the hardest part, is that we get so freaking isolated.
Yes.
And
also, Jill, and you know what, not even that, Jill, is when I was the girlfriend that I've had for so many years, she said, just get here. Just get here. I'll send for you. Just come. Just get here. And we'll take care of each other. And I thought, you know, that is like what you and I talk about, what you talk about on the IC network is about. And I'm not saying that everyone has it. I hope that you do. I hope that the IC community does. I really do, ladies and gentlemen. I hope you do have a support network. But my husband was in the military, and we were gone I'm from Ohio originally, Dayton, Ohio, and we were gone for over 30 years. Mm-hmm. My husband was in the military for 25. And so there are people that I haven't seen for a long time.
Yeah.
And those are really good relationships. And I'm not talking about Jill. I mean, she's a staple. That's not what I'm saying. I'm saying that when it was time for me to want to come or want to go to Dayton, Ohio, my girlfriend said, just get here.
Right.
We'll deal with it when you get here.
Right.
And then you know what? We'll deal with it when it's time for you to leave. And that was a big eye opener for me, because it was like I had support. I had someone saying, your pain is what it is. Hey, I've got issues too. I've got high blood pressure. I've got high cholesterol. I've got, they were talking about the things that they had too. So it was almost like, and I'm not saying that is an equivalent. What I'm saying is that it didn't scare them. They weren't afraid of me. They weren't afraid of that, me talking about my pain. And so I want all of you to know that if you just open up, and Jill used to talk about, and she doesn't at this particular moment, but if you've been with Jill for a long time, she talked about issues with people in your life. And if they don't understand, or if they're not willing to come along with you, then maybe you need to drop those people in your life. Because when you have IC, you need people to come along with you in your life.
Well, you need to be.
You don't need people to hang on to you, for a death grip. But you need and you want people to be with you in your life that understand that when you go to them after 2 weeks or a month, and you say, I'm not feeling well, and I'm in pain, that they say, that's okay. Okay, I'm with you. What do you want to talk about?
Yeah.
Let's talk about something that's uplifting. Let's talk about something wonderful. We can do this. Not, so you're not in pain. Oh, so what? So you're in pain? Tough. No, that's not what you need in your life. And she talks about stress. She did it today. She talked about anxiety and stress that goes along with that. And I'm telling you, it does.
It does. But we also have to be really practical. Okay, so you're going to take a plane flight. So what are you going to do to prep for the flight? So let's.
I'm already prepping, Jill. You
Okay.
know what I told Mark? I said, you know what? I'm not stressing. I'm going to do a little bit at a time.
Good.
I'm going to pack a little bit at a time. I'm going to think about what I need, what I don't need, the things that are going to work for me. And I'm not going to be at the last minute doing a doggone thing, Jill.
Right.
And then when it's time to get on the plane, I'm going to get on the plane.
Right. Okay. And are you going to have a little bit of muscle relaxant with you?
You got that right, baby. I got all my medications with me. I've talked to my doctor. I love you, Jill. You like smiling. Yes, I've made sure that I've had, my gabapentin with me. I've got my Cymbalta, which I do take. Yes, I do. And I've got my cholesterol medication. I've got my blood pressure. I've got my vitamin D3. I've got my Piora. I've got it all with me. And you know what? I'm going to use it as my cocktail whenever I need it. And I've got it all bagged up. Jill, hey, wait a minute. I'm prepped already, Jill, before I even get on the plane. Okay?
Right. It's perfect.
You, Jill, I'm going to call you before I go. It's August 5th, just to let you know.
Okay, well, you know who to call if you need a pep talk.
That's right. I said to Mark, I said, you know what? I haven't bugged her, and I'm not going to, but you know what? Before I go, August 5th, if I have to call her that weekend and go, Jill, just tell me something, I will,
Right. Exactly. So, hey, we are having a Zoom issue. You clicked on the link I gave you, right?
Yes,
to get in, but for some reason Facebook can't get in. So I tell you what, let me, Donna.
No worries.
I'm going to shut this one down, but I'm going to restart it back up, and you don't have to come back in. Let's just see if anybody else wants to come in. A big giant hug to you. Oh my God.
I love you. And that's why I'm here. That's why. And I'll try to come back in if I can. I know. I'm going to hug you. I know.
Okay. So you guys, when we all have our next real IC meeting, national meeting.
Oh my God.
Do you know how funny it is going to be? So funny when we all meet each other, and we're all going to be jumping up and down and hugging each other. It's going to be great. It's going to be great, but it's still going to be it's going to be a couple years off probably.
And it's going to happen. And it's going to happen. They don't. You know what? I think our IC family doesn't believe it's going to happen, but Jill, we're going to make it happen.
We'll make it happen. We'll make it happen.
Baby.
It is either going to be in California or it's going to be in Colorado. It's not going to be on the East Coast.
Colorado would be great in the mountains, Jill.
I know, right in the middle of the country. That would be the goal.
Thank you.
Yeah.
Thank you.
Okay, so I'm going to shut down this Zoom, and I'm just going to try to open it up another way to see if I can fix these Facebook people, okay?
Okay,
Big giant hug to you. See you later.
I love you.
Right back at you. Okay, let's turn this off real quick.